Hello everyone, and welcome to the third Talking Tuesday video series where we review frequently asked questions and topics specific to health links and coordinated care plans. In this session, we'll be talking about maximizing the care team approach. So the first question is, what is the role of the integrated care lead, or the ICL? The integrated care lead may be the first person to identify that a client would benefit from a coordinated care plan. They can initiate the conversation about having a coordinated care plan, and if the client would like to move forward, then the integrated care lead would review the patient agreement form and complete the consent form. They establish a good rapport with the client and whose services align with the client's goals. From there, the ICL, or integrated care lead, can initiate the care plan and begin to build the care team with the client. So really, they are the lead contact person for the care team and the client. And we really do encourage that the ICL organize a care conference, if it is required, to establish the care team and begin to work on goals and an action plan for the client. They are the ones that can communicate major changes between the client and the care team members. We found in the past that the most appropriate person to be the client's ICL is usually the person that has the best rapport and relationship with them. They may also be the one providing the majority of the services that are aligned with the client's current goals. Once an ICL is established, it should be updated on the consent forms, the initiation form, and of course the coordinated care plan. The roles and responsibilities of the integrated care lead moving forward would then include being the lead contact person for the client and the rest of the care team as previously mentioned, providing that communication between the client and the care team members only as needed as it pertains to the coordinated care plan. The ICL will work collaboratively to help the client and care team members work together towards the client's goals and achieving those goals. The integrated care lead should have in store the most updated version of the coordinated care plan, and they should also communicate with the rest of the care team when there is a change in the client's status or as it pertains to the CCP. When applicable, they should also share copies of any documents with the client and the care team. This role is really not meant to be exhaustive or overwhelming at all. It's really meant to be an evolving role where others can step into the role of the ICL as a client's needs change or as goals have been met and new ones have been established. The next question is, what are the role of the care team members? So it is important to remember that all of the roles and responsibilities do not just fall on the integrated care lead, as we just talked about. The rest of the care team does have a role and responsibility to play in the person's trajectory. Their care team members include individuals to whom the patient has consented to contribute to and be involved in their coordinated care plan. Just like the integrated care lead, the services and supports they provide should align with the client's needs and goals. Care team members can include both formal and informal care providers, so really think outside of the box as to who that may be within your organization. Informal care team members can include family, friends, neighbors, or even someone from church who provides food or transportation. Basically, anyone that the client feels is a support and that they want to be part of the care team. The roles and responsibilities of the care teams are very similar to that of the ICL. However, they are not the lead contact person, nor are they responsible for the communication to the rest of the care team members. They are collectively responsible for supporting the client throughout the coordination care management process. The expectations of the care team members are that they contribute to the development, monitoring, and updating of the coordinated care plan. Members of the care team are also encouraged and expected to actively participate in the care conference, support the client in achieving their goals, and contact the integrated care lead to communicate any changes in the client's health and well-being. If care team members have access to Health Partner Gateway, then they should update the coordinated care plan on the portal. And if they are in the paper format, then they should be updating their copy and informing the ICL of major updates if there's any that are needed. So just like the integrated care lead role, the care team members are also meant to be an evolving role and will be dictated by the client's goals and needs as they evolve throughout the process. The next question is, what is the role of the client? So the client also does have an important role and responsibilities in the coordinated care plan as well. If the client agrees and consents to a coordinated care plan, then it's expected that that themselves or their substitute decision maker collaborate with the ICL to establish their goals and create an action plan that will support them in meeting their health needs. In collaboration with the integrated care lead, the client can help to identify members of the care team, actively participate in the care conference and the development of their coordinated care plan, and work towards achieving their goals as per the coordinated care plan itself. We do highly encourage that whenever possible, give the client some actions to complete that gives them some onus and responsibility in their own care. So really they're having that own autonomy and independence that gives them that motivation to want to achieve their goal. The client can also contact the integrated care lead with questions and concerns about their coordinated care plan or any changes in their health status. The client is the one that advises providers outside of the care team that they also have a coordinated care plan in place. They're willing to share personal information with members of the care team in a confidential manner. And lastly, the client is the one that engages in exploring their needs, goals, strengths, and opportunities that will inform the development of the coordinated care plan and the required actions that are to follow with that. The next question is, when do I transition to another integrated care lead? So this too is an evolving role and may happen a few times depending on the patient's journey. Assessing a client's readiness for transition is an ongoing role for the current integrated care lead and the care team members as well. So there are a few scenarios when the client may be ready for a transition to a new integrated care lead, such as when all the sections of the coordinated care plan have been completed or are no longer relevant, or when the integrated care lead's services are no longer warranted or meet the client's need, or also when the ICL is no longer a major support to the client and their goals. A decision and agreement about the transition should occur with the members of the care team and the client to really ensure that everyone is on the same page and is ready to begin the process. Once it is determined that the new integrated care lead is warranted, the next step is to ensure a warm handoff. We would encourage another care conference to establish the new goals and to determine the new integrated care lead to begin the planning process of the next phases of the coordinated care plan for continuity of care. An integrated care lead will be identified and clearly communicated as a single point of contact for the patient during this process, while the care team members will continue to collaborate and be responsible for the care of the client based on their new goals as outlined in the coordinated care plan. So once it is determined that the client will be transitioning to a new integrated care lead, there are a few steps that need to occur, which will answer the question of how do I transition to a new ICL. As mentioned previously, a warm handoff process is very highly encouraged, and consider a case conference or joint visit with the client to discuss the process, determine new goals and needs, and to establish the new care team and integrated care lead. Really ensure that the client is aware of the new integrated care lead and has their contact information. The coordinated care plan needs to be updated to reflect the new ICL, both in paper and HPG format, and the initiation/update form and multi-agency consent form needs to be completed and faxed into the LHIN. The patient agreement form can be used again and provided to the client to really identify the new integrated care lead and provide the client with their contact information so that they're aware of who they can contact. And lastly, ensure that the care team members are all informed of the transition and have a safety plan in place where each member of the care team is committed to supporting the client as outlined in the coordinated care plan. Next, we'll discuss what forms need to be completed when transitioning to a new integrated care lead. So the coordinated care plan has to be updated to reflect the new ICL. If the coordinated care plan is in Health Partner Gateway or HPG, you need to update the patient demographics and section C of the coordinated care plan initiation and update form, and then fax this form and the multi-agency consent form to the LHIN. A new patient agreement form can be given to the client that identifies the new integrated care lead and provides the new integrated care lead contact information. Lastly, ensure all those involved have the most recent copy of the coordinated care plan, so really they're kept up to date about communication and what needs have changed. Next is who is responsible for updating the coordinated care plan when a client has been hospitalized. The client's recent hospitalization details can be updated within Appendix 3 of the Coordinated Care Plan. And if this Coordinated Care Plan is in the paper format, you'd want to update your own version and then contact the Integrated Care Lead to inform them of the changes in status. The ICL can then communicate these changes with the rest of the care team. The Coordinated Care Plan can be updated by anyone that has access to HPG, reflecting the most recent hospitalization. If any care team members have been informed of a hospitalization, they can update the Coordinated Care Plan in HPG and should contact the Integrated Care Lead to inform them of the situation that's taking place. So where should updates to the CCP go? Any updates to the Coordinated Care Plan should go in the corresponding fields. For example, if there has been a new diagnosis, then the My Health section should be updated in the Coordinated Care Plan. Updates should be completed within the My Goals and Action Plan section under the corresponding subheadings as follows, and we'll look at this on the next slide to follow. What I hope to achieve, a goal has been added or changed, what we can do to achieve it, so it's very specific actions to enable the goal to be achieved, and then detail. So this is in reverse chronological updates on the specific actions taken for each goal. And remember that the Coordinated Care Plan is meant to be an evolving document that changes throughout the client's journey and not one that remains stagnant. So these changes can be made at any time, and oftentimes it is very much so encouraged. So when we look at this chart here, so this is a section from the Coordinated Care Plan, the My Goals and Action Plan. So in the left-hand column here, you can see what I hope to achieve. So this individual, you can see the client here is Carolyn and the Integrated Care Lead is Shannon. So Carolyn is saying, I want to find a new family doctor in Niagara Falls by the end of May. So what can we do to achieve it? So Carolyn will review Healthcare Connect or niagaradocs.ca. Carolyn will contact the doctor's office listed in Niagara Falls. Shannon will support Carolyn with any sort of physician notes or applications that need to be taken place. And then the Integrated Care Lead will also support the client to register with Healthcare Connect. So here are some of the details. We won't go through all of them, but you can see the most recent one being April and the furthest one being May 25th. Who will be responsible? So again, identifying the different roles and parts of the care team. And then the date the goal was identified. So the year, the month, followed by the day. And lastly, we'll just be going over some key takeaways and some summary overviews of what we've just discussed. The Integrated Care Lead, or ICL, the care team members, and the client all have collaborative and active roles in supporting the client in achieving their goals and to meet their needs and established in the Coordinated Care Plan. The roles of the Integrated Care Lead and the care team members are evolving and may change throughout the client's journey. The client should be an active participant in the development and implementation of the Coordinated Care Plan. In assessing the readiness to transition, it is an ongoing process, and remember that this may take place a few times throughout the patient's trajectory. When transitioning to a new Integrated Care Lead, a warm handoff is considered to be the best practice. It's important to ensure that the Coordinated Care Plan and the consent forms have been updated to reflect the changes during the transition so that everyone is made aware of the most recent updates that have taken place. Complete the appropriate forms and ensure that everyone involved has the most updated version of the Coordinated Care Plan.